Alright, hello again. We are here today with Dr. Pawlowska, and we're going to be talking about gestational diabetes, something that she is an expert in. So, just on a base level, what is gestational diabetes?
So, as you've heard from other videos, diabetes is a disease in which you can't process sugar very well. And by process sugar, I mean take it out of the bloodstream, put it into the cell where it can be used for energy. So that can either happen because you don't have enough insulin or because your body is resistant to insulin. Gestational diabetes is diabetes that first develops during pregnancy, and we tend to check for that condition somewhere between 24 and 28 weeks of gestation.
So, what would cause gestational diabetes?
So gestational diabetes develops as a result of placental hormones. So as the placenta grows, it starts to secrete hormones that act against insulin. And insulin is the key factor that allows you to use blood sugar out of the blood and use it as energy for within the cells.
Mm-hmm. Okay.
So it's those placental hormones that prevent insulin's actions.
How do we test for gestational?
So around 24 to 8 weeks, your obstetrician or family doctor will send you for what's called an oral glucose tolerance test. And basically what that is you drink a really sugary liquid, and we measure your blood sugars at set times. Mm-hmm. So at 1 hour and 2 hours after you have this sugary drink, and we see how well your body deals with that sugar. So the lower the number, the better. Okay. And if the level of sugar in your bloodstream is elevated past a certain threshold, that's considered having diabetes.
So who would be at risk with gestational diabetes?
So anybody can develop gestational diabetes, but there are certain higher risk features for developing it. So if you are overweight at the time of pregnancy, older, if you have a history of things like polycystic ovarian syndrome, if you've ever given birth to a large baby, which is defined as greater than 9 pounds or greater than 4 kilos, if you have a family history of type 2 diabetes, or certain ethnic backgrounds also put you at higher risk. So patients of Asian descent, Southeast Asian descent, Native patients.
Now we're going to get down to why do we treat gestational diabetes?
So we treat gestational diabetes to help prevent any complications for the mom and her baby. Because the maternal and the fetal circulation are joined through the placenta, if mom has high blood sugars, those high blood sugars are also seen by the baby.
Really?
And the baby's pancreas is working already, so the baby tries to compensate for those high blood sugars by secreting high amounts of its own insulin. And the combination of high blood sugars in the fetal circulation and high insulin, it's kind of like a fertilizer for a flower. So the two combine together and cause the baby to grow larger than it should for its gestational age.
Really? Okay.
Mm-hmm. So because the baby can grow large, that can predispose to a couple of things. The main problem being, as you can imagine, at the time of labor. So if a mother is trying to deliver a baby that's larger than it should be, that baby can get stuck in the birth canal. And that's a condition called shoulder dystocia, where the head comes through the birth canal, but then it gets stuck at the level of the shoulders. There is evidence that children that are born too big for their gestational age to a mom who had gestational diabetes are at risk of developing diabetes themselves, high blood pressure, obesity, and high cholesterol. Mm-hmm. But if we can prevent that overgrowth, then their risk is no higher than other children their age.
Okay. And so how do we go about treating this?
So gestational diabetes management is all about managing the blood sugars. So what you will quickly learn to do is, if you're diagnosed with gestational diabetes, you will use one of these machines.
Okay.
And this finger poker.
There you go. Now I can see it.
To check your sugars somewhere between 4 and 7 times a day, both before and after meals.
4 to 7 times. Okay.
Now, the mainstay of treatment for gestational diabetes is through diet and exercise. So, you will see one of our dietitian colleagues, and they will help you choose better carbohydrate foods. And they'll also teach you about portion control and spacing out your carbohydrates, so that over the course of the day you're still getting all the nutrients you need, but in a way that prevents the sugars from spiking.
So healthy choices and meeting with the dietitian can be a big part of it, and then healthy lifestyle as well.
Yeah, so exercise is the other big feature of managing diabetes. So we advise women to walk within the hour after a meal, and that can be anywhere from 15 to 20 minutes. That's generally sufficient. And the reason we advise for that is because, as I mentioned, glucose is a fuel for the body, and your muscles use glucose for energy. So when you're walking around, your muscles need more fuel. So if you walk after a meal, whatever you just ate will go into the muscles, get utilized, and your blood sugars will be lower.
Okay.
Does that make sense?
Yeah, okay. I understand. So you can sort of wear off some of it as well.
Perfect, yeah.
Okay. And then, does that always work? Or if you're eating right and you're exercising as much as you're supposed to be, but it's not quite enough, what do you do at that point?
So I always tell women that there is a possibility that diet and exercise will not be sufficient, and I tell them that it's not their fault if that happens. It's just a manifestation of how strong their placenta is,
Okay.
and how strong those hormones are that act against insulin. If diet and exercise are not enough, what we tend to do is use insulin in pregnancy. And the reason we use insulin is because there's plenty of evidence showing that insulin is quite safe for the baby.
Is that a last resort, or is that something that can be avoided otherwise, but is still safe?
I don't like to say that it's a last resort, because like I said, some women just need it. So if you need it, you need it. It's
Okay.
You're only going to need it for a few weeks until that baby's born, and then you can come off of it. So I try to reassure the women that it's not their fault and it's not that big of a deal.
Oh, yeah, for sure. After the baby's born, after pregnancy, at that point, does gestational diabetes tend to go away?
Yeah, because after you deliver the baby, is the placenta follows, and when the placenta comes out, all those counter-regulatory hormones that fight against insulin are gone out of the circulation. So generally what we see is that women who had normal sugars before the pregnancy will go back to having normal sugars after the pregnancy. However, we do know that if you develop gestational diabetes, you are at increased risk for developing type 2 diabetes in your lifetime. And that risk is actually substantially increased. So what we generally tend to do is 6 weeks after the baby's born, we ask that the patient still goes for a repeat glucose tolerance test, just to make sure everything's back to baseline. And assuming it is, which in the vast majority of cases that happens, we still advise patients to see their family doctor on an annual basis and be screened for type 2 diabetes.
So it sort of is a warning sign.
That's a warning sign, yeah.
Okay. All right. Well, that's great. I've definitely learned a lot about this, and I think we're going to be talking to a dietitian and talking more about exercise as well. So I think all this stuff is kind of a holistic approach to all the kinds of diabetes. And yeah, thanks for joining us.
My pleasure.
Great. See you guys next time.